Okay, you're now live. Greg, oh yeah, I was just gonna say tip that down so he could see you.
I was trying to look like everybody else, so I was gonna.
Action.
Exchange for your service, you get to go on a trip to the Bahamas. Or you get $54.82.
Okay.
You would just sign it.
That'll be a margarita or two.
It is. It is. Maybe one.
Then you have to cash it at Cancun down there.
Okay, perfect.
All right, but we are
But it's the deluxe kind.
on public.
Bonnie, we can't hear you if you're talking.
I was just wondering who's taking a vote? Are we going to the Bahamas?
Did you move, Miss Barker?
This is my new office.
Oh, it's lovely.
Yeah.
It's quite the conference table you have got going on there.
I wish this actually here. I can change this. How about?
It is a little hard in the room
let's
to
see.
hear you,
How about
Bonnie.
this?
Yeah, can we turn the volume up on the speaker up there?
There. I have sunset now.
Can you turn up the volume on your computer, Bonnie?
I'm using a microphone. I'm not sure. Let's see.
I do hear her pretty good, so I think it might be your speaker.
Yeah, I think it's our speaker.
How is that?
Better.
Okay.
All right, well, it is 5:30 and I'm going to go ahead and call to order this meeting of the Dunn County Health and Human Services Board for May 27th. Welcome, everybody. This is the first time in 14 months that some of us have been in the same room with each other. So this is kind of a milestone. We are really fortunate to have a new board member joining us tonight, Dr. Alexandra Hall. And so instead of the traditional call of the roll, I will start, but I would like each of us to introduce ourselves just briefly, and then we will ask Dr. Hall to introduce herself just briefly, and then we'll go ahead. So I will start. I'm Diane Morehouse. I am the chair of the Health and Human Services Board. This is my first term as chair and my first term as a committee member. It's been interesting. It's a challenge. I'm a county board member from District 21, which is essentially Ward 9 in the city of Menominee.
Hi, and I'm Sarah Kennedy. I'm on the Dunn 21 number also. I've been on this committee several times.
Sarah, I hate to interrupt. Can you speak in your mic?
Oh, I'm sorry. Sure. I'm Sarah Kennedy. And I was telling her that I've been on this committee a couple of times and it's a great committee to be on. I was a county employee for 37 years. And I've been on the board since 2012. Very interesting.
My name is Gary Steen. I'm vice chair of the county board. I'm also vice chair of this committee. I'd like to welcome you aboard. And it is a good committee. It does a lot of good work.
Thank you.
And I'm Chris Corpola. I'm the Health and Human, or not the Health and Human Services. Sorry, Katie. Taking you over. I'm the Human Services Director.
Chairman Bartlett, and then we'll go.
Okay, I'm David Bartlett, board chairman. So I'm on every committee.
Greg, the County Veteran Service Officer, been here probably 10 years in the position, so around a bit.
Great. All right, shifting to those of members on the screen, Supervisor Bjork, will you introduce yourself, please?
Yes, Dr. Hall, welcome to the committee. I'm Larry Bjork. I have a farm in the town of Springbrook. I continue to work for Walmart and go back there later on this year as a driver. I've had some medical stuff that has me off right now, but I've really welcome you to this committee and anxious to hear what you have to say. Thank you.
All right, I'm going down to Jody Cromry.
Hi, Dr. Hall. I'm Jody Cromry, District 13, and I've been on the board since April 2020. Welcome.
Ms. Barker.
Hi, I'm Bonnie Barker. I'm a citizen member. I spend most of my time in Boyceville as the Director of Special Education and School Psychologist.
Mr. Lamb.
Good evening. Hello, Dr. Hall. My name is Bill Lamb, and I'm also a citizen member, and look forward to as anyone else said, what's ahead here this evening and going forward. So thank you.
Yeah, thank you. I think you know KT, but let's ask her to introduce herself and the other staff people as well. KT.
Sure. Katie Gallagher, Dunn County Health Department Director. I've been here as in Dunn County for a little over 3 years now.
Sarah.
Sarah Stabenow, Senior Accounting Manager up in Admin Finance.
Terrific. And Dr. Hall, will you tell us a little bit about yourself?
Sure. Thank you everyone for the welcome. I'm excited to be here. So I'm Alex Hall. I am a physician trained in family practice and with kind of a lifelong special hobby love of epidemiology. And I also teach at Stout in the biology department, teaching things like anatomy and physiology. And I'm just really interested in our community. So I'm excited to be able to participate and hopefully be helpful.
Lovely. Thank you. We are absolutely delighted that you're willing to give up your time. All of our citizen members on the committee, thank you for what you do. All right. Moving along, I have minutes in my hand from our April 22nd, 2021.
I so
A motion from Supervisor Steen. Is there a second?
I'll second.
Thank you, Mr. Lamb. There's a second. Any corrections, additions? Hearing none, all in favor, say aye.
Aye.
Aye. Minutes from April 22nd are approved. Krista, do we have any public comment?
There was no public comment.
All right, thank you. Let's do this now, Chairman Bartlett. The next meeting is June 24th, and we have had a request to change our meeting time. Do you want to?
Yes, I can explain that. Now that we've gone to hybrid meetings, our major meeting room is room 54, and that is set up with a better speaker system. It also with admin has been meeting at 3:30. So like today, they have 2 people on staff covering one meeting because the meetings could overlap. Where if I'm asking that we go a half hour later and admin decided to go a half hour earlier. So that should open up room 54. So we would be able to have our meeting after admins in room 54. If you noticed, they had to bring cords in from the other room to set this run up. It's more economical and just makes a lot more sense if we could do that. But to do it, we'd have to at least move this meeting probably a half hour later.
All right, so certainly more efficient for our staff. Are there any strenuous objections to the next meeting? And obviously going forward, so long as we're going to be doing this to 6 p.m. If you have an objection, please raise it. Supervisor Steen?
We probably need a motion.
I don't think so.
I don't.
I don't
Okay.
think so.
I was wrong.
This is a consensus decision. I'm not hearing any objections. So
Thank you then. Thank you to the group because it makes a lot of sense. Thank you.
yeah, I think it does. So we will next see each other on Thursday, June 24th at 6 p.m.
In room 54.
in room 54. And I assume even a month from now that we will still be doing hybrid meetings.
Well, I actually think going forward forever, we're thinking about doing hybrid. It's easier for our staff, for a number of our staff that may only have to participate in the meeting for a little while, that they won't have to come and sit through the whole meeting, that they can do some work at their desk and be there to be called upon. Also, if a member of the committee can't make it, instead of using the phone that was cumbersome before, this is a lot easier. And I think the biggest thing is our public can watch the meetings. They can go back and watch them. You know, they're recorded. They can go back and watch them later. I just think there's a lot of benefit. So I think moving forward, all our committee meetings and probably our county board in the future will be hybrid.
Well, I do think for members of the public, it's really nice to have this available. Okay, so 6 p.m. June
Can I
24th.
ask a question?
Certainly, Bonnie.
Will, because we've already gotten an invitation to it, it's already on my calendar, on my phone. Will the new one be sent out? Because we can't edit these on our phones.
Yes, I'll send you a new one.
Thank you.
Okay, we'll send out a new calendar link. All right, moving on. I had asked for the benefit of Dr. Hall that each of our 3 departments do a very brief overview of function before we go into staff reports. I think that would be helpful. It's certainly not going to give you the full picture, but at least it's a start. So can I call on you, Mr. Quinn?
Oh, yeah, absolutely. So the overall mission for the Veterans Office is to assist veterans, dependents, surviving spouses with a variety of benefits, and really couple that into three levels. There's federal benefits, state benefits, and we have some local benefits, and it's our job in our office is to help them navigate that. It's our job to ensure that we're well versed in all of those benefits, so that we can assist them with expectations, understanding kind of right and left limits with what they may be entitled to, and help them through the whole process from honestly from infancy until the grave. Outside of that, there's also a number of other areas I kind of call a little bit more specialized when you're dealing with crisis intervention, and that can encompass a lot of things from food insecurity to homeless prevention to suicidal ideation, homicidal ideation. All of that is our role, because we're the ones that have the information stuff to help really mitigate a lot of that stuff and ensure that they've got the safety net support systems there. Any questions about that?
Does helping them navigate benefits and services also apply to the VA medical services as well?
Yes, specifically federally within the VA system, there's 3 legs to that stool. You have the Veterans Health Administration. It's our responsibility to assist them in enrollment, to even getting to appointments, to navigating some of their new programs where they've expanded services to authorize care in the community, which Mayo's on board, Marshfield, Prevea, and that's kind of a new process for them. Then there's the Veterans Benefits Administration, and that helps put recognizing did the service hurt them, break them, do they need assistance ensuring they don't fall into poverty? There's a variety of benefits, and the last one is, of course, is cemetery burial.
Thank you.
KT, would you like to do a brief overview of the Public Health Department?
Sure. So our mission is actually in the report that you have that I'm going to present to the county board. But just to read it, the mission of the Dunn County Health Department is to promote the health of all people in the community by collaborating with community partners, working towards a safe and healthy environment, preventing disease and disability, and promoting positive health practices. That's a mouthful. But really what that means is that our 4 divisions, our community health division, which encompasses reproductive health and communicable disease prevention, our environmental health division, and our public health division and public health administration divisions all work together and work collaboratively with community partners to address community identified health priorities and statutorily required health needs.
Questions?
When
Well
we
done.
get to the report, I'm sure I'll have lots.
Well done. And Chris?
Well, I wish that I could be quite so concise, but probably not. So the Department of Human Services really provides services across the board from really birth to late in life. So I'm just gonna kind of go a little bit by sections. We have a children's disability resource group that does both our Birth to 3 program, which is early intervention for kiddos with delays or disabilities, providing OTPT speech and home teaching. We have then some of those kiddos, and then those kids that are a little bit bigger. We have a children's, we are part of a children's long-term support program that provides wraparound services through Medicaid, like respite care, daily living skills, adaptive equipment, home modifications, vehicle modifications, those types of things. An economic support section, which does all of the eligibility determinations for publicly funded entitlements like Badger Care, food share, childcare. Family and Children's Services section does youth justice or juvenile justice, kind of delinquency related services, and child protective services work. And then our behavioral health section has grown immensely in the last 6 years. And so we have an outpatient mental health clinic with both outpatient therapy and then psychiatry, a psychiatrist and a APNP who provides psychiatric services. We have a first episode psychosis program, which deals with youth between the age of 15 and 25 who are having a first episode of a psychotic episode. We have a comprehensive community services program, which is a wraparound program for folks who are mental health or substance use, looking at kind of self-directed moving into recovery. And then we have a community support program, which is a wraparound program for persons who have chronic and persistent mental illness. So a lot of those people will serve for a better part of their adult lives. And then finally, we have an Aging and Disability Resource Center, which provides both aging services, so transportation services like the doorstop bus service and volunteer drivers, the nutrition program, Meals on Wheels, the congregate and home delivered meal sites, and caregiver supports, including caregiver group programming for people who are providing cares to family members or whoever. And then the other part of that is we are also the agency that does eligibility determination for publicly funded long-term care. So through the managed care organizations like CUSA or Care Wisconsin, or all of the different organizations that provide those same things that happen for those kiddos, but for adults, respite care, daily living skills, employment services, all those sorts of things. We determine the eligibility, and then those are delivered through managed care organizations. And then the last piece, which really is currently housed in behavioral health, but which actually is going to move back to the ADRC at the end of the year, but is we also are the agency responsible for doing adult protective services for elderly folks and vulnerable adults.
Thank you. And so just to clarify, the eligibility determinations for the publicly funded long-term care through managed care organizations, that's those things that you talked about, like in-home services and things like that.
Yes.
Okay. Sometimes when I hear long-term care, I think nursing home.
Yes. No. It's
Thank
really
you.
everything up to, well, and actually that's it's really everything kind of up to that point. So assisted living, care apartments, those kinds of things are all part of that.
Thank you.
ERFs.
Okay, good beginning orientation and probably an excellent review for those of the rest of us who've been around for a while. Thank you all. And each of these three departments is extremely well run and providing excellent service to the community. So moving along, item 7, veteran service. Greg.
All right, good evening, everyone. So I'll start off with the staff report. I have kind of a memo summary that, and I'll just touch on the highlights. And again, starting locally, of course, Monday, May 31st, Memorial Day. The month of May, there's of course, you have regular duties to assist the public, but then there's also a little bit of preparation to ensure that every grave in Dunn County is provided its the respect that it deserves, and we help coordinate the placing of about over 4,000 flags, and those flags go on veterans' graves identified. We don't always get notified if we have a veteran from outside the county that comes in and is interned in a cemetery in Dunn County, but we will find out, because there's the great thing is the family and loved ones will let us know that their grave is not properly marked before Memorial Day. So there's over 82 cemeteries in Dunn County, and we have just an incredible amount of volunteers that go out and take and place these flags out there. So we have, from the beginning, we have a couple volunteers that will put them together with the list and the location. And then in these cemeteries these flags have been placed on there. It's honestly, it's a family matter, because there's typically a family member of theirs that is interned in that cemetery, and they will not give that up. And they will ensure that whole cemetery is taken care of. So there's a lot of loyalty. Like in 10 years, almost 10 years I've been doing this, we've only been able to hand off one grouping of cemeteries in that whole entire time, because they find their own replacement. It's within the family. So that's it's a great show of respect and honor. So the other thing that I want to highlight, along with kind of Memorial Day, the Dunn County Patriotic Council is going to be hosting an event down at the Evergreen Cemetery, which is the Island Cemetery. There's a Grand Army of the Republic monument there that is the Civil War. And the speaker this year is going to be Nick Lang, Army veteran, served over in Korea, and also is an employee of the County Corporation Council. So he's volunteered to speak. We've also began the pre-planning process with the Dunn County Historical Society. There is some traveling exhibits from the Historical Society down in Madison that we're doing a selection, but we're going to try to do something in September to honor those that have passed in Wisconsin that were in the Vietnam War. It's kind of like a traveling wall. So we're still got some more planning, and it's going to be out at the Historical Society. And they got, and I'm kind of ashamed to say I've never been out there, and we went there for a meeting, and incredible, absolutely incredible with their location and what they have to offer and stuff. So I think we're going to have a nice partnership with them. A move to the state benefits. There really, from last month, there hasn't been anything significant, no changes that are worth reporting. On the federal benefits side, a significant approval on the federal level congressionally is with they have added those service members that served in the offshore waters of Vietnam during the Vietnam War. They've added that grouping, 12 nautical miles. There's some naval terms. It's called the littoral. I never knew that until I went through a class, and so it's technically 12 nautical miles from. It's basically as you draw a horizontal line up from the coast out. Each country has that. That is their land. They get to police it up, and so there was an incorrect interpretation by the VA that was technically part of Vietnam. You get out past 12 nautical miles, then you have like your fishing borders and stuff for nations. So it's a huge thing. We've already been seeing some veterans being able to receive benefits. But the VA is going to go through and take a look back on a lot of past denied claims, and even some of the death benefits. If those veterans were off those coastal waters, there may be some additional benefits for their surviving spouses or dependents. And part of that is on us as well as an office. When we get time, we'll go through and scrub death certificates to see if there's some of those causes of death for those veterans. And some key things we'll look at is, were they in the Navy, and what were the conditions that are listed as cause of death. And it could be very, very significant. They'll go back. We're talking $200,000 of benefits that we can possibly help people with. So that's an important piece that we'll be continuing to look at to help some of our veterans out and their survivors. And again, financially, I'll kind of go a little bit more depth in the expenditures and revenue, but there's nothing significant that I need to point out at this point. And again, still within the pandemic, so there's business as usual. We haven't stopped, and we still continue to work with individuals in person and in parking lot, wherever they want us to work with them. And yeah, we're fully staffed in the office. We get 10 to 12 hours a week from volunteers. They're great. One's a retiree from Stout. The other, well, actually both of them, I think, come from Stout. They're great volunteers in our office. Any questions about that part of my report? All right, then I'll move to, there's two documents that kind of identify, it's called our Veterans Served report. And so we try to quantify what we do, because everybody likes numbers. You want to know that you're getting bang for your buck. And so we've been, I have a fiscal year 2020 document that does not list impact statements on the bottom, and the fiscal year 2021, so that you can see the so what. I'm showing you what's happening now, and you can do an assessment on what happened last year in the same month. And so we can analyze any trends, which already know what happens in May. Already know what happens in November, because of Veterans Day, when we're around any of those important dates, there's an uptick in certain services that we do. But I would say you'd be able to see the trend in item number 10, medical equipment loan closet. And if you look back and do a little some pandemic assessment, when the hospitals shrunk some of their services to just their most important, the term escapes me, there's less need for medical equipment, because there's not people transitioning out, but now we're seeing more, kind of almost like on a normal basis. So I think that's important to note. Moving into the impact statement, I always want the board to know some of the success stories, and there's plenty in there, and they're just the matter of a lot of the veterans dependents kind of being patient with the process and trusting the work that we're doing to get the outcomes. And sometimes that's the hardest thing to do, is wait in the time process with the federal programs. The first impact statement that I'd like to note is a veteran who was assaulted in service, and been working with him as identified in 2012. Right, came shortly after I first started, and had basically just kind of the assaulted injuries, over-the-counter meds to prescription meds to assist with, and then some of that stuff dries up, then you start using the non-over-the-counter and the non-prescribed medications, and then things, you start to get in a little bit of trouble and stuff. But in hanging with the veteran and stuff, we were able to get the post-traumatic stress, the mental health disorder, documented and supported, which really identifies a huge safety net for him and his family, because along with some of these other challenges, you're also dealing with trying to keep the roof over your head, keep food on the table, and you have young ones. And so it's been a nice thing. He's doing great in school. And so it took quite a while, and he stuck with it and went through the process, and things have turned out well for him and his family. The next item, a frustrating thing with the VA at times can be processing of non-VA payments or for medical care. And in this instance, I've been working with this family quite some time. The gentleman had heart issues, Vietnam veteran. It's a presumptive disease. He had a heart attack at home, called the ambulance. Ambulance goes there. The VA is supposed to cover that. However, they did not transport him because he was deceased. So then they called somebody else to transport. The VA denied it, even though they're responsible for it. They denied it, and the spouse is just supposed to worry about mourning the loss of her husband. Then on top of that, she's dealing with an ambulance bill that's not being covered, goes to collections, and finally, through probably 4 years of work, the VA finally paid it. And we just needed to talk to somebody to explain to them that it is not the veteran's fault that he wasn't able to be transported. The emergency still was there. And so once you get that face, or I wouldn't say face to face, but that phone contact with a decision maker, you usually can get things resolved quickly. And so the last one, again, as an individual surviving spouse, that we were applying for a survivor's pension. And with those, there's just an immense amount of documents that go along with it, from bank statements to asset proof, power of attorney to who's dealing with the financial part, but the individual just needs in-home care and somebody to help pay for that. And that's where the VA was, the assistance was going to be provided. It took over probably 14 months and 2 appeals to get them to agree that the primary residence was her primary residence, because it was listed in the trust. And some things you can interpret in the entry level VA employee didn't see that, and they considered it an asset, which primary residence is an excluded thing. So anyway, got it done, and now it's going to help quality of life to be able to ensure that more of the in-home care is going to be paid for. So I always want to make sure that we can try to put a face to some of the work that we do, and to know that everything equates to money coming into the county, but there's faces to that as well. So there's no questions on that. Then I'll finish up with the budget report. We have budget expenditures, revenues. I print the actual report right out of SAP, and top right I indicate, and SAP's the financial software that we use. Top right corner indicates the date I pulled it, and we're at midpoint, small budget. I don't see anything significant that is noteworthy at this point. And I'd certainly let we typically, the areas that really focus in on are the soldiers and sailors relief, to make sure that we're managing that, to ensure that we're getting, if there's any needs that veterans have, if it's to prevent homelessness or utility shut off, which ironically, I had a veteran get his utilities shut off like a month ago. I thought there was moratoriums on stuff related to COVID, but we got to turn back on. But it was a little surprise. He had a few extension cords run, keep the refrigerator going, but got it. Neighbor didn't mind. So any questions regarding the budget? At this point, nothing significant to report regarding that. I don't foresee any challenges here in the near future to that.
I just have a general question as a newbie. Is the financial year the calendar year? Or the fiscal year is the calendar year?
Yes.
Or, okay, thank you.
My compliments, Greg, on your patience. I mean, how much was the ambulance bill?
$800. And
4 years.
yeah, and I honestly, there is a point when, and which I was at, there's a point where you have to quantify your time. And, do we just go ahead and consider using the Soldiers and Sailors Relief Fund to make the family whole? But then there's principle. The VA is responsible for this, and it's and this surviving spouse did not need to deal with. But I appreciated her sticking with. She actually brought me the sheet showing it was paid and said, I don't want to ever see it again. But I appreciated that she provided that to me.
Absolutely. Any questions from the committee for Greg or comments? All right, thank you. Oh,
Man,
sorry. I'm
one
so
more
sorry.
thing. June, I am a tentative to attend. I'm on duty during that time. However, I will be around. And if I don't have to do extra stuff in the evening, then I plan on report and I'll make sure that I'm on vacation, but on duty. So
We'll knit you into the agenda planning.
yeah,
Bill?
please, yeah. And I'll let Chris know if I'm going to be able to attend, because I'm on vacation but doing duty. So I'll get it. I'll get my report to you.
All right, thank you. Yes, Supervisor Steen.
Yeah, I would just like to mention to our new member that one of the things we have asked Greg to do is to give us the monetary impact of what he does as it relates to the county, both for disability pensions and also for healthcare. Because if the healthcare is paid by the VA, that's a bill that doesn't have to be picked up by the county or whoever. So, and we thought that was important to raise the awareness to the general public about the importance of his job.
Can I add?
Their budget's going to the county board, says $24 million.
I'd like to, if I can, request that we're able to deliver our annual reports, at least give an elevator speech of 2 to 3 minutes in the future. Because I know the last 2 years we haven't, it's just been a read report. And I would like to be able to at least give a 2-minute elevator speech on here's why this is important.
I'm looking at Chairman Bartlett.
We may go back to that when. we
2 or 3 minutes would be helpful. Could he make a public comment? Or
I think it would be more if he wanted to add it.
okay. We'll ask you if you want to add something.
Yeah, it was last month, but just going forward, I think to me, it's important. And that's why I'm bringing it to the committee, and you guys can decide on what you need from us.
I think it would be an integral part of his report, actually.
Oh, I think moving forward, once we start meeting in person again, get back to more normal circumstances like we used to be.
I know I did bring it up in executive committee because I think it's a significant benefit back to the county. All right, thank you. Moving on, number 8, Department of Public Health Staff Report, KT.
Good evening. So I sent out my report last night. So that's a normal situational update associated with COVID, as well as a couple other things, the respiratory report for the state of Wisconsin, and some of our Western Wisconsin Regional Public Health Readiness Coalition reports. So I can share my screen if that would be helpful.
I think so, yes.
Okay, so this is today's updated numbers associated with what's in the situational update. So 4,683 Dunn County cases. That is an increase of, I believe, 2 over what's in your packet. And I did want to share that Today, we had no new cases come through WED, so not too many days where we've been at 0. So we're hoping that that does hold a little bit. So in the situational update, you guys have, again, the comparison to Wisconsin, our surrounding counties, our place in the world. An update about percent positivity. We are seeing a little bit of a reduction in some of our testing, which is not to concerning levels, but we are seeing that be reduced with a percent positivity as a 7-day average of 2.4%. So definitely much less than what we would look at for community spread at 5. As I was sharing our case numbers, or our disease activity is consistently going down. We are just a hair over medium as our activity. So right now we're at moderately high. The cutoff for the state is at 50 per 100,000. And we are just the tiniest bit over that at 51. So my expectation is that we will continue to see reduction in cases here in Dunn County as more people get vaccinated, as people change how they do what they do with a larger emphasis outside. Fingers crossed. And then some information on vaccination, again, where we are here locally as well as to the state. We are at 33.9% today, and we continue to be just a little under, well, not just a little, significantly under the state as far as our level of vaccination. We are still in the bottom quartile. I think we're lagging behind in most age demographics, as I had shared before. Still continuing to find some of the movable middle folks where the barriers to vaccination, maybe because they work very long hours. So we are partnering with a couple farms to do on-site vaccination for folks that want to offer that for their staff. We are partnering with the food insecurity groups here in town so that we can provide easy walk-up vaccinations. And then we're partnering with the Western Regional Public Health Consortium and WestCap to provide support for transportation. So if transportation is your barrier, we have a little grant that we will be able to access through the Western Region Public Health Consortium and WestGap to provide gas cards to make sure that folks getting there for both the first and the second shot are eligible for a $25 gas card. So we are working towards increasing vaccination within our community. I did want to share one quick update about the CDC's guidance for fully vaccinated people. There are 4 settings that are not included in that guidance update, and that is obviously healthcare, because we are dealing with folks that we could assume are at higher risk of being immunocompromised. And then jails and other congregate living situations like homeless shelters, just because of the risk that we've seen for infection. Public transportation anywhere where we have a federal mandate. And then schools. Schools are asked by CDC to continue their use of all non-pharmaceutical interventions, regardless of vaccination status, because so many people within the school setting are unvaccinated, and people under 12 are not able to be vaccinated at this point. And 12-year-olds, even the earliest adopters, so the people that most wanted to be vaccinated, won't be fully vaccinated until later next month. So still not able to be vaccinated. And then the other things that I included in what I sent out were the respiratory virus surveillance report. This is something that I do every flu season. You guys will see from this report as you scan through it, we continue to have very minimal flu. And we are seeing a little bit of an uptick, and maybe you guys have heard this as you speak to others in the community, of a couple other seasonal viruses, but not COVID. So that's a really good thing. And then as a reminder, the Public Health Consortium's weekly update, these are all live links. So if you wanted to get some help sleeping or wanted to read a little bit more about the types of resources that we're putting out and that we have access to, you can link or click those links and read more. Sorry. And then I did want to slip in, since it didn't make it as a separate agenda item, my apologies. I did want to slip in the Dunn County Health Department's annual report. You have all, how many pages? 9 pages in your packet. This is the same format as last year, but of course, the things that really stand out to me are the change in delivery of services, as what we did was really consumed by COVID and our COVID response. So that was huge. And just the people hours towards it that were taken away from other services. So I wanted to see if there are any questions about any of that in your packet or what I shared today.
We don't technically have to approve the annual report, but but certainly if you have questions or comments, please pass them along to KT. This goes to the board in June.
I have a
Yes,
question.
Supervisor Steen. Just a moment, please. Supervisor Steen was ahead.
I got 3 questions for KT, not regarding her report, but can you give me a ballpark figure, KT, on how our incident rate would reflect on the Red Cedar racing situation?
I want to make sure I understand your question. So what percentage of grandstand would be allowed based on our current?
Yes.
Okay.
Yes.
So they don't race this weekend. I found that out after I communicated with the racing president, but we had 11 Dunn County cases in the 7 days before, so Wednesday to Wednesday, and that would allow them to have 75% of their grandstand open.
And then
Sorry, go ahead.
No, you go ahead, finish your thought.
That is not including anybody that chooses to be vaccinated and demonstrate that they're vaccinated. That was, as the board move forward, that is in addition to.
Thank you. My second question is, and I don't know if you or Chris can answer this. At our ADRC meeting, we discussed the aggregate congregate meeting or eating areas. And I wonder if anything has happened regarding going back to in person with any of those.
So definitely in consult with the ADRC manager, Lonnie Dodge, and it looks like that is something that they are exploring. I don't know, Chris, if you have a timeline on that?
Not yet.
Okay, thank you both. And then this is just a comment. I'm on the library board in Colfax. And at our last meeting, we discussed should we open up or not open up. And what we're doing in Colfax is we're waiting and following the IFLS direction. So we're not doing anything until they say they're doing something. So I just thought I'd share that with you.
And can you help me? Who's the they in that? You kind of broke up.
Oh, excuse me. The library board in Colfax for the Colfax Library.
Who's IFLS?
Oh, and we're waiting for the Indian Head Federation library system to give us guidance on how we should open as a library.
Thank you for that. I did have the opportunity to speak to the Menominee Library Board as well, and they have decided to move forward with the CEC guidance and open.
Thank you.
Supervisor Bjork.
A question I had would maybe new member would also like to know. At the last board meeting, there was a $200,000 grant or payment that helped medical workers that the work during the COVID that equal to other pay. How many people were involved in that? Could you just explain that a little bit? I mean, I thought it was a really good thing, but what your comments on that?
It was a one-time staff bonus to health department and staff at the neighbors. I'm not entirely sure of the numbers that Chairman Bartlett, remind me if I'm wrong, the total figure was like $396,000. And the maximum payout, I believe, was 2,500. So you have to do the math, Supervisor Bjork.
Well, I don't really need to do the math. I just wanted to say I thought it was a good idea. And were these county employees that were only receiving that money, or other?
I believe so. Yeah,
So
and they had to be employed by the county at the time that the checks were cut, which was a week ago or whatever.
They had to be employed June something.
Yeah, okay, so
Excuse me, it was based on hours worked on how much each employee.
yeah. Yeah, there was a formula in the resolution that we looked at, which I can't recall what the formula was, but it was, yeah, based on hours, additional hours served. And yeah, I agree with you, Supervisor Bjork. It was a small token.
Was that also, and it was discussed at the meeting a little bit, was that to bring the county employees up to the level of payment that other outside contractors were receiving? That wasn't the comment made that county employees then were equal to the outside contractors that were hired?
I think that was
At
for the neighbors.
At the neighbors, that was the case.
Okay, thank you.
Okay. Are there other questions for KT? Thank you for the situation report, and the annual report looks great. Do you want to do finances, or would you like to turn this over to Sarah?
I would love for Sarah to do it.
Hi, Sarah.
Thanks, KT. I will share my screen to this one. Can you all see that?
Yes.
Okay, great. I'm going to start on the expense tab. I have annualized the total expenses for the health department so far. So if everything continues the way it is, it looks like the expenses at the end of the year would end up at $1,545,458.42 for the expenses. And for the revenues right now, I've annualized all the revenues that have come in. And if everything continues where it is, the health department would end up at $1,588,034.08. This also includes the property tax allocation to the health department of $498,614. So with those two numbers calculated, it looks like the health department would give back $42,575.66 back to the general fund if everything continues and there's no huge expenses that come about.
We don't yet know if the additional federal money if there would be additional federal money for the health department.
Are you referring to ARPA?
Yes, I am.
Yes, we don't know the allocation that would be given out yet for that. So
okay. Thank you.
Definitely could change everything that I just presented.
Exactly. Questions for Sarah or for KT? All right, thank you both.
Great.
Number 9, Department of Human Services staff report.
All right, just a couple of quick updates. So our building is slated to reopen on Tuesday to the public. For us, that means a few things. One, because we are the first most obvious spot that has reception, it means that there's increased foot traffic for them, but that part is fine. But we also have to bring people back in order to handle walk-in crisis appointments, walk-in people who are reporting child abuse, neglect, or elder abuse, adult protective services, those types of things. So we anticipate that that will up the number of people in our offices slightly. However, the last year has certainly taught us that we can function fairly well in a hybrid model of in-office and remote work. And I believe that many people will continue to take advantage of that option since they're set up to do that. Just a little update on, you guys probably are sick of hearing about CDBG. CDBG is the Community Development Block Grant. So you've had to pass numerous pieces of resolutions and ordinances and things in order for us to have that money. We finally have all of the pieces into the state. We're all good to go. But the cool thing that I wanted to share is that West Cap and Stepping Stones have really stepped up to the plate to create a really nice partnership with that money. And so the plan is that people will come in through the system, into the system through Stepping Stones, be temporarily housed in a hotel, but then immediately pass the ball to West Cap. And West Cap has hired a full-time case manager to work hand in hand with Stepping Stones and then to take over, trying to eliminate the obstacles for people to get to full-time, sustainable housing. In that process, they were able to procure 2 houses here in Menominee, that one for men and one for women. One's 5 bedrooms, one's 6 bedrooms. The funding will allow them to lease those through the end of next year. And people will be able to move from, as there's capacity allows, to move from the hotel to those houses while they work on resolving the issues to get them into longer term housing. The sort of the sad part about that, honestly, is that so one is for men, one's for women, sorry, six beds for women, 5 beds for men, and the women's house is full
Already.
So and there are 2 men, I believe. Actually, I'm not 100%. I don't think they can move in until, but anyway, but they've worked really nicely together. So that is definitely meeting an immediate need, and it's been a nice program in spite of all of the hoops that we had to jump through. And then the last thing I just wanted to reference, because it's kind of the big law that's been looming in the child welfare and youth justice world, there was federal legislation passed about a year and a half, going on 2 years ago, called the Family First Act. And it really does 2 things. One of them that's a little sort of less relevant to us in a day-to-day way, and that's that it created, it de-incentivized like residential types of placements for youth, unless those residential placements do a lot of things while those youth are in placement. So basically, the only way for the state to capture back some federal money is if those residential placements attain a new level of certification that provides a broader range and more intensive services. So that piece, they're called qualified residential treatment, and there's legislation in the works to create that process of certification for those. So that's sort of one piece. And yes, it will impact our youth when they go to those kinds of placements, but it doesn't really directly impact us. But the other part that does really impact us is that there's also a huge shift federally as well as in the state of Wisconsin towards trying to maintain children in their homes whenever possible. And you'd think at some level that would be common sense, but like all other things, systems swing. You know, you've all experienced Get Tough on Crime to Hug a Thug and back someplace to the middle. It's similar in the world of, if you think about the evolution of where kids have stayed over say 100 years. You know, we've been in orphanages, we've been in with relatives, we've been sort of all over the page. And so now the push is really to allow, to incentivize, again, federal funding that the state can draw down as communities build additional community resources. So part of the biennial budget request, or but the governor's budget requested an additional $12 million, to a little over $12 million to the state to pass through to the counties to build those community supports. And so about a week ago, I got a telephone call, received a telephone call from one of the administrators in the Department of Children and Families. And she said, kind of word on the street with the Joint Finance Committee is they're considering throwing that $12 million out because they haven't heard enough about the need. Will you quick contact your local legislators and we quick write a letter or whatever? So I just wanted to read you what I wrote, and then I called as well, but wanted to read you what I wrote because I think it doesn't, I think when you get to the end of this, you'll hear it's five short paragraphs long. You'll hear kind of the sum total of the work in this particular area. So I said that in this email, I lay out a request to you as a Joint Finance Committee member. This was to Kathy Bernier, Senator Bernier. I lay out this request to you as a Joint Finance Committee member to continue $12,342,700 in the 2020 biennial budget for child welfare in-home prevention services. In the 2019-2021 cycle, counties received a significant increase in child welfare funding, and for Dunn County, that funding has made an enormous difference. We were able to add 2 social work positions and cover some of the large amount of levy that was being used to fund out.
Chris, I think your mic went out. It may not be working anymore. Matt may have to grab you a different one.
You hear me? Yeah.
Yes. Yes.
Okay. Let's see here. Our out-of-home placement numbers dropped by a third. And we've been able to add 3 significant services: supported supervised visitation, parent peer supports, and an evidence-based parenting program. Speaking candidly, I've been involved in public child welfare work for a long time, 36 years. In my career, I've had the privilege of working with a social worker who grew up in foster care. She and her 9 siblings were removed from their parents' care when she was 5 years old, and she and her younger sister both aged out of care at age 18. I witnessed firsthand the multitude of conflicting outcomes that her experiences created. She taught me much about the importance of trying to prevent out-of-home placements and to maintain strong family connections whenever possible. I'm very thankful for that the focus for child welfare is finally catching up to the science and to people's experiences. Data continues to show how, in spite of our best intentions, placements are not a panacea, and that often the decision to seek placement requires a balance which is likely to be less, requires balancing, which is to be less damaging, maintaining a child in the home or an out-of-home placement. The huge difference between my friends' experiences from 50 years ago and those of our kiddos today is that we know so much more about how to support families and safely keep kids in their home. But those supports require services and funding. And as in all system change, you have to fund not only the current system, but the changes until the changes take root. To this end, counties' hands are tied. With levy limits, even if Dunn County thought expanding in-home supports was the best idea in the world, it could only do so if it decides to discontinue doing something else. We simply have no extra money for this important work. In 2021, Dunn County's expected cost for all child welfare youth justice services was budgeted at $3.3 million. Our total state support in the form of base allocation and grants was $1.5 million. Our required state county contract match is 9.8%. As budgeted, our match is over 1,100%. That number is incredulous, and I had to run it through an online calculator to make sure that I wasn't speaking in error. I wasn't. You've been an amazing advocate for mental health, and it was exciting to see your dogged pursuit of a means to address mental health bed space. I ask you to help us to intervene further upstream with children and families we serve by supporting the in-home safety services pot of money. And then I attached a attachment to her. But I think it captures kind of that whole big picture of where the county's at, where the kinds of supports that we need to be able to give families in order for us to not end up with kids in care, what it takes to sort of stem that flow from farther upstream, all those sorts of pieces. So I remain hopeful that that money will remain in the budget and that we'll be able to continue to move in the direction that we're going. But that's what I have to say about that.
I might suggest that you share this with members of the committee in the event that they also might like to contact Senator Bernier or other members of the Joint Finance Committee.
Yeah,
Would
I can
that
do
be
that.
appropriate? All right, thank you. Supervisor Steen.
Yes, Chris, I got two questions on the change in the residential residents. Would this change weed out some of the bad actors, do you think?
I don't know that there really are bad actors. Well, it's hard to say. You mean by the providers? I don't think, I think they're gone.
Okay.
I think that we're stuck between a rock and a hard place in a sense, because some youth have extremely, extremely challenging behaviors based out of a lot of all kinds of influences. But I think that we also continue to believe that somehow if you remove children from the home and you put them in sort of this place, that they're going to be magically fixed and returned. And that some, I don't know what that is, the Wizard of Oz, I guess. And so I hope that, and I know that this is a part of all of that, I hope that there's just a greater emphasis on the fact that it has to be a family intervention and that you have to be able to, and I mean, we push for that, but the system, it's the government, it's slow to change. So I don't think there are a whole lot of bad actors anymore. The kids have gotten way too challenging to stay in the business if
you just want to wear out.
if you just want to make money. Yeah.
My second half of the question is, do you think that these increased guidelines and requirements will substantially add to the cost of housing these kids?
Absolutely. Absolutely. It's already very expensive.
Thank you.
Excuse me, other questions for Chris or comments? If not, finances, and I assume that this is Sarah.
It is.
Hi, everyone. Can you see my screen now?
Yes, we can.
Okay. I'll just go right to the projected summary version of the financials to present. That would be in what I'm presenting now as column F. Our grand total of expenses for all of DHS programs and services, including salary and fringe, is $12,591,574. I've separated that out to the operating and salary and fringe in the next two cells. The operating for DHS is $7,913,304. And DHS's salary, including internal financial, is $4,678,270. So with all those calculations and breakouts and everything, we were going to use, with my projections, $3,183,364 of county levy. So in column G, it shows if everything stays annualized the way that I have it, DHS would give back $995,552 of the county levy allocation that was given to them.
Don't start spending it.
No.
No.
I was gonna say, this is April?
Yes,
Supervisor
this is
Steen
it.
has a question, Sarah.
Yes.
I don't think you're going to get off so easy.
Oh, I gotta go. My internet connection. No, I'm just.
Yeah. So with tongue in cheek, I can go out and say that we're going to give almost $1 million back. And Sarah says that's the way it is. Can I do that?
No, please don't do that.
Just kidding. Thank you for your hard work.
You're welcome. Is there any other questions?
Any other questions for Sarah?
What I would say about that though is in 2018 when we were significantly over, and part of that was those youth placements or those children and youth placements that we've been able to address in a different way. But when we were in 2018, if you went back and you compared the report from this time of the year, then we were already projecting at about $800,000 in the red. Yeah. So, and that just never rectified itself. So, this will not stay at $995,000.
Wasn't that year too that we had the adult placement?
Yes.
$365,000.
Yes.
Yeah.
Lots. Yes. So, this won't stay this high because again, good point, Diane. This is really a financial report. This gives us all paid expenditures through March.
So it's not even the first right of the year. So it's a lovely figure, but I'm not sure it will remain. Okay, any other questions? I can't see everybody at the moment. See any hands? All right. If not, we'll move forward. Thank you, Sarah, and thank you, Chris, for those reports. Item 10, we have April vouchers to review. I need a motion to note review of the April vouchers. That total figure is $516,942.49. Is there a motion?
I so move.
Supervisor Crum removes. Is there a second?
I'll second.
Ms. Barker seconds. Any discussion, questions?
Madam Chairman?
Supervisor Bjork?
I'd like to just roll back a little bit to the foster care just before.
Can we act on the vouchers first, please? We have a motion and a second on the floor.
Yeah, you can. I was just trying to be pleasant.
Let's take action on the vouchers. We do have
Okay.
a motion and a second.
Okay.
All in favor?
I have a question,
Aye.
actually.
I have a question.
Oh, you do have a question? Never mind. Okay.
Sorry,
Question.
I don't know what we're talking about. What are the vouchers?
Okay, that is what I am speaking about.
Okay.
The vouchers
Okay.
are,
All right. I'm sorry. I was rushing us.
yeah,
I stepped back.
So every month, so by the way that the county's financial ordinance is set up, every month this board has a responsibility to review the bills that have been paid by the
Already
Department
paid.
of Human Services. So you
All of
have
these.
that
All of
whole
these.
long list of vouchers. Yep.
Okay,
The
all right.
report comes directly out of our financial system. It's written in a bit of financial system ease. And I didn't do it this month, but I've been trying to every month do a little bit of at least a summary of a few of the different vendors that we're paying to get an idea. But the bills have already been paid. So it's really a review. It's not an approval of the expenditures because the money's gone.
Yeah, and I was just going to add that
That's
we're
helpful.
not approving these. We've noted that we've reviewed them.
Got
for
it.
months.
Thank you.
Supervisor Bjork.
thank you, Madam Chairman. This has always been a sore spot for me because it's asking us to review, it used to be to approve these vouchers. And if there's ever anything that I've ever been involved with, this has been the strongest, go along to get along as I've ever experienced. and I just draw your attention to House Calls of Menominee Incorporated. We had reports from different areas of veterans and health and human services and Chris. But, you know, I really don't know anything about House Calls of Menominee. And we never seem to have a report from them. We don't know how many employees they have. I would like to just pick out one and say, well, what does it mean? What does it mean for agency contract for salary? I mean, how many different people are on salary? And every time that they make a trip to a client, then is that another charge on the transportation? And I mean, you know, you could say that it's you know, we don't need to know who's doing what. But I mean, if you're a foster parent, your name is on here. If you are had some medical work, your name is on here. And also, I think they've made it harder to read. I know that the print is smaller this time than it has been before. If you look at the print where it has background check and fingerprinting, state of Wisconsin, you know, it's a different size. So I keep asking, how come we don't know anything about House Calls of Menominee Incorporated? And I never hear anything back. And basically, Larry, go along and get along. And
I believe Supervisor Bjork that we have had at both an oral explanation and a written explanation of the county's and the department's work with house calls.
But I think it's a good time with Dr. Hall for a quick review. So many years ago, like longer than I've been in Dunn County, so more than 20, the county was the so back to that long-term care determiner of eligibility, the county was the determiner of long-term care eligibility and the deliverer paid for the delivery of those services. So if someone was aging and they were eligible for daily living skills or some kind of supportive home care or whatever that might be, we determined their eligibility and then we found vendors to provide those services. And so so there were a lot of people that were eligible for like personal care and supportive home care, personal care, and then like home health-ish kinds of services. And so we had many million dollar contracts with a number of vendors. And there was a ton of negotiations back in the day about, they're not negotiations, but a ton of sorting out over the fact that you had to create these layers of employment because you didn't want to create a situation in which all of those people out doing personal care and supportive home care were viewed as county employees. They needed to be somebody's employee. And you weren't going to add every personal care, supportive home care, daily living skills trainer. You weren't going to add all of them to be county staff. So there were a number of entities in those years who sprung up or came into existence for the sole purpose of leasing staff to the counties to do that work. And there was at that point in time, so we had House Calls, was one of the organizations that was born out of that time, whenever that was, long ago. And another one was Gemini Employee Leasing, was another organization that worked locally. There were a couple of other smaller ones. Gemini has since gone out of business a number of years ago. Those little ones are gone, but the one that has remained is House Calls. And so House Calls is the leased staff provider for the Department of Human Services. And if you will recall, we've had conversations about the fact that it has costed less to replace a position that becomes vacant in the county with a house call staff than with the county staff, largely because of the cost of our health system, our healthcare, our health plan, and the Wisconsin retirement system. And so, so we have over the years, post collective bargaining and Act 10, we have transitioned a number of positions that were county positions to now be house calls. So that house calls contract is over $2 million, but it represents about 35 staff co-located in the Department of Human Services, providing services side by side with our staff, oftentimes with exactly the same title. They're paid about the same amount of pay, give or take a few pennies, but they receive their benefit package, their payroll, their personnel related services through house calls. So that's why those are large numbers. That's why they, you know, it adds up quickly and they show up every month. But those are part of our social work staff, part of our behavioral health services staff, part of our ADRC staff, our house call staff, and those decisions were made. All of that was vetted through the Committee on Administration a couple of years ago, just to make sure that that was still the direction that the county wished to go. And the decision was, if the issue is that you can save, say, $5,000 to $10,000 per position by those being leased staff positions, that sometimes that's the difference between having the position and not having the position. What I would say is we've worked really hard to work with house calls to make the pay equitable, and house calls has worked really hard to make the benefit package more equitable. And honestly, they have a generous PTO, paid time off package. They have insurance, they have health insurance, they have affordable health insurance, they have a small retirement plan. And so we have staff now who choose to stay with house calls rather than apply for a vacant county position because they like house calls better as an employer.
I have a follow-up question, Chris. So those folks are working alongside county staff. Are they supervised then by you if they're working in the Department of Human Services? So we have
the way we kind of talk about it
oversight.
is, so house calls does all the personnel stuff, including hiring, firing, and discipline. But they obviously take input from us, and then we provide their day-to-day sort of direction.
Okay.
So
it's not like it's just here,
Yeah.
you take care of these needs. It's
Yep.
here, come help us take care of these needs.
absolutely, yep.
Thank you.
And they're awesome staff, and they've, you know, many of them have been with us for years and years and years.
I appreciate that because I saw all these listings. I was like, who are these people?
Does that help, Larry?
Yeah, it really does. But I'm sorry, I still have a question or two.
No, go ahead.
Where some of them are listed under behavior health grants, and then you got family and child grants. Are these funds that are not part of Dunn County levy, or what does that mean when it's a
Right.
grant?
Right. So when we receive, and grants has kind of a funny name in our financial system because it might mean truly a grant, like a foundation gives us a grant, or it might be money provided to us by the state for a specific service. So, or specific purpose. So what we might call, we often call our base allocation. So the Department of Human Health Services and the Department of Children and Family Services provide us with a pot of money every year that we have some flexibility in how we spend, but we're to meet our statutory responsibilities for the things that we're required to provide on behalf of the state, or being an arm of the state. So when that state money comes to us or foundation money comes to us, it gets put into a special cost center called grants. And you're right, that's not county levy.
Okay, thanks a lot. Then my very last thing is the print smaller, or am I just over?
You know, I don't know, because honestly, it's entirely possible. Only because trying to get these behemoths of spreadsheets onto one page and not kill a printer and 4 ink cartridges in every printing. Sometimes requires smashing things together so much small. So it's entirely possible that they're littler. We'll provide what do they call those? Microscopes. Those are
Magnifying.
magnifying
glasses.
glasses. Magnifying glasses.
Maybe Supervisor Bjork could get compensation for new glasses. I'm just kidding. I'm sorry, Chairman Bartlett. I'm sorry. All right. I'm sorry. I can't see. Oh, yes, I'm sorry. Supervisor Cromrie. I can't see you, so sorry.
Thank you. I just had a question, Chris, under the cost center for crisis.
Yep.
Just the Northwest counseling and guidance for that one on 414, why it was so much higher or at a higher rate than the others.
So Northwest Guidance and Counseling operates Northwest Connections, which is they're our contract provider for 24/7 call service. So they're actually in the right across the street from us here in the government center. They're in a building right along 29 there. And in the basement of that building, they serve 28 counties in Wisconsin to be that where you can call the crisis number and you get them. But then, so we pay a monthly fee for 24/7 calls coverage. And then we also pay from 4:30 in the afternoon until 12:30 in the evening. We have mobile crisis coverage. So basically, if someone's having a mental health crisis, generally suicidal, and law enforcement is called out to the house, and then they first step, they call the call center, and they have the call center person kind of walk through a crisis assessment. But if that is like inconclusive or they feel like the situation's volatile enough, then Northwest Connections can dispatch a mobile crisis worker who will go out and join law enforcement and try to do a deeper assessment to see, is that person indeed safe to stay at home? Can they kind of put together a safety plan to keep them at home? Or can they go to the hospital voluntarily, or do they need to be emergency detained? So I'm not sure exactly what you're looking at, but my guess is it's
Page 1.
Page who?
Page 1 at the bottom, $8,270.36.
Yep, that is that is the monthly call and mobile crisis. It's about $100,000 a year contract for that 24/7 call service. So during the day, if someone walks through our door in crisis, we will handle that crisis through our outpatient clinic. But anyone can call Northwest any time of the day and get a crisis worker on the line. And they handle about roughly 12 to 1,400 calls a year for us.
Okay. Thank you.
That responsive, Supervisor Cromrie?
Yeah, thank you.
Other questions? Okay, moving on. We have a motion and a second to note review of the vouchers for April. All in favor, say aye.
Aye.
Opposed? Vouchers are noted. All right, we have 3 action items. And Dr. Hall, these are items that this committee approves to pass on for subsequent action to the county board. One of these is a resolution about proceeding with a housing study, which we've talked about housing in this committee, but we haven't specifically talked about this. And 2 of these are budget adjustments, which essentially represent grants coming in to the departments that need to be essentially added to the finances. So item number 1 is a resolution approving a Dunn County housing study. I will walk us through this, but excuse me, I will walk us through this, but I need a motion before we go ahead. Authorizing the
Bill.
Department of Human Services to engage in a housing study.
This is Bill. I'll make that motion.
All right, Mr. Lamb is moves. Is there a second?
I'll second.
Dr. Hall seconds. This is a resolution authorizing the county in recognition of a really significant set of complicated issues around housing to engage in a housing study that would look at the causes, at the issues, the causes of those issues, barriers to housing development, which is an issue in the county, and to make specific recommendations for policy actions that the county and other perhaps municipalities in the county could undertake to address those issues. A number of us on the Board of Supervisors have been working with the Health Done Right Housing Action Team for about a year. And the Housing Action Team is comprised of about 30 people from various sort of ends of the housing spectrum, from those housing the homeless. So the Stepping Stones housing coordinator, and they certainly provide almost all of the emergency housing in the county, to developers, to real estate agents, and other interested stakeholders. And the group recognizes that there are significant housing issues, both for extremely low income people, for people experiencing needs for transitional housing, as well as for workforce housing, which is a huge issue in Dunn County. Bringing on employees at any level is quite difficult, given that there isn't either housing available, or the housing that might be available is simply not affordable. So the Housing Action Team and several supervisors, Supervisor Steen, Supervisor Tripp, Chairman Bartlett, Chris, and I have been thinking about this issue for a while. And we know that West Central Regional Planning Commission, which provides services to the county, has done several extremely well done housing studies in other counties, addressing the issues, addressing availability, addressing affordability, involving a large number of stakeholders in working through the issue. We invited them to meet with us, suggested that our concern was not so much in the absolute data that they could provide, but in the way that those data could inform the way that this county can make some decisions about what to do on the housing crisis. So we are recommending that the county be able to contract with West Central Regional Planning Commission to go forward with a housing study that will be supervised and participated in by the county. The good news about that is the Community Foundation of Dunn County, which has been working with the whole Health Done Right process. Each of the five action teams that grew out of the health assessment has been awarded some grant funds to support a specific project. The Housing Action Team has been awarded a $10,000 grant from the Community Foundation to support moving forward with a housing study. So costs for the county will be essentially minimal. There may be additional costs as other municipalities elect to join in the housing study process and have a study that is specific to their own needs. So this is a resolution from this committee going to the county board, authorizing that we undertake such a study. Chris, do you have anything else to add, or Chairman Bartlett or Supervisor Steen?
No, I don't think so.
Yeah, this authorizes us to move forward, but we don't really know what exactly we'll be asking for until we find out how many other communities
Yes.
are willing to participate and what And then after that, we'll decide if there's some options of whether we want a survey to go out.
Absolutely.
But
Yeah.
this is the first step.
Yep.
That's
correct.
I like that you figured out how to fund it, even though it is coming out of the $990-some thousand that was going to come back to the county. It'll be $3,000 less.
Yeah.
And it may not even end
And
up
it may not
being
even get to that.
So the funding equation is that $10,000 that the Community Foundation gave us will essentially cover a Dunn County-wide study. However, if any municipality, Colfax, Elk Mound, City of Menominee, want to have a deeper dive into their municipality community related information, those are about roughly $8,000 a piece on top of, so they'll capture all the information for Dunn County at large, and then they'll do a deeper dive for about $8,000 a piece. But the West Central Regional Planning can write a CDBG grant to cover 2/3 of that cost.
Exactly.
So by the time that you take the 2/3 that they can find, add the 10,000 to the top of that, and then figure out the split between all the rest of the counties, the absolute most it would be $3,000, but that would mean every municipality was going to be involved, and that's unlikely.
In both the Barron and the Polk County studies that West Central Regional Plan engaged in, they were successful in getting the CDBG money that paid for, as Chris has said, 2/3 of the cost of the study. So it's a pretty good
They
bargain.
seem to be successful in getting other communities to participate also.
Have been. But once the county board approves this, then
Right,
we need
then it
to,
can
we
go
need to
further.
do some work on scoping this out. Who wants to be involved in it? Have had some initial context
This
certainly
is-
with the city of Menominee, and the city is certainly considering strongly moving forward with this.
Did,
As
Chair-
Mr. Lamb,
Person Morehouse, did you ask for someone to volunteer for something? Could you-
I did not.
Okay, I misunderstood what you were
volunteering?
saying there.
Whatever it is,
Well-
yes.
If you were, I would say yes. If you were looking for a volunteer to do what I thought you said, I would, but I guess you weren't looking for a volunteer, so I will not, if you do, I'm here to volunteer.
But
I
however,
cer-
I am holding you to this because one of the things that we've talked about is a kind of advisory team that would work with the ongoing study. And so you're the first name on the list.
Okay, thanks. I say that because through my job, I'm well familiar with the Polk study and Barron's, and more so Polk's. And they did a great job. It was well received in the community. They did a event via Zoom where they presented it to the community, and there was great participation, and they're putting it into action. So I'm excited about this for us.
Yeah, and I'm also excited. I'm a county representative on West Central Regional Plan Commission, and they do excellent work. Other questions, comments,
Jody
issues?
had one.
Supervisor Cromry?
So on the front page, the first page, the budget impact should indeed say 3,000, up to 3,000.
Yes,
Yeah.
I've changed that somewhere, but yes, let's make that amendment right now.
Okay. Sounds good.
And I'll fix it for the resolution going forward. But yes, that correction the two numbers on the front and the back should match, not $3, I think that is.
Yes, it's a typo. Thank you for pointing that out. I didn't see it.
Nice move, Chris.
Well done.
I have a picky question.
Certainly.
So on the second page, looking at the bulleted items of the key questions included. And so things like looking at the unhoused population, on need for transitional housing, which we know are huge concerns for our community. They aren't kind of spelled out here. And so there's just a part of me that wonders if we need to be really purposeful about that, so that we don't just get, in order for employers to be able to attract people to your community, you need more homes in this price range. And that we wouldn't get something that looks at the whole
Yeah,
gamut, which
no,
sounds like your plan is but it just wasn't spelled out.
Yeah, and I think you're right about that. But yes, I think the plan is to look at the whole gamut of housing issues that I know in Barron County, issues of housing accessible for the aging and assisted living care and so on were included in the study. So
Wonderful.
yes, yeah, you're right to point that out. Other questions or comments? Are we ready to call the question on this? All in favor of moving forward with authorizing the Department of Human Services to engage in a housing study and to apply for and receive grant funds to support the study? Say aye. Aye. Opposed? All right, that passes. We have two budget adjustments. DHS is first. A budget adjustment, $4,287. This is an increase in the Birth to 3 grant fund. Anything else to add, Chris? Nope. All right, I need a motion to approve.
I so move.
Supervisor Steen, is there a second?
I'll
Supervisor Bjork, thank you. Any discussion? All in favor, say aye.
Aye.
Opposed? The budget adjustment for DHS is approved, and a budget adjustment for the health department in the amount of $2,000. This is a grant from Healthcare Education and Training HSET to increase public information on the importance of sexually transmitted infection risk awareness, etc. I need a motion to approve. Supervisor Cromrie, thank you. Is there a second? Ms. Barker, thank you. Any discussion? Questions?
If I can just share some context, this is
Certainly.
so HSET has a Get Yourself Tested campaign, GYT. And so this is specifically for GYT. It offsets some of the cost of getting tested for folks that may not get tested otherwise and has specific outreach components. Right now, we are seeing an uptick in our STI cases. I did put out a health advisory this week that we are at significantly increased cases. We've got 14 confirmed cases of gonorrhea. Last year, we had 5 by the same amount of time. And our demographics in those cases are really shifting. We saw the youngest at 13 and the oldest at 61. So really some of our population that may not realize that they're at risk for STIs. We're also continuing to see a lot of co-infection, meaning people are not following through with treatment, or there is a lot of high-risk sexual behavior. And so this $2,000 is not a lot, but it does help us gear some outreach materials and support people getting tested for STIs so that they can be treated and not spread it to their partners.
Any other questions or comments? All in favor?
Aye.
Any opposed? All right, the budget adjustment passes. So next meeting is June 24th at 6 p.m. and we will send out a calendar adjustment. Are there any announcements or comments or volunteer opportunities?
Madam Chairman,
Yes, Supervisor Bjork.
can I tell my foster parent story now?
Can you tell your what story?
Foster parent story?
Is it brief?
For me, it's brief.
Please go ahead.
This last weekend, my sister from Florida was here and celebrating her birthday, and our entire family was here, including our foster daughter that lived with us for 10 years. And I'll give you 2 fun little stories. She would, help me, in the barn feeding cattle, and we would have an auger that would deliver corn into a cart for the cows. And I always insisted that she would fill the cart half full or 3/4 full. And it was very frustrating for her to someone tell her half full or 3/4 full. And years later, she said, well, you did help me learn my fractions by doing that. And then the other thing that came out this weekend that I thought was interesting and fun is that she was 16 years younger than Lucy and I. So I says, you know, when we went out on the football field for parents' night when she was a cheerleader, it seemed like Lucy and I were a little younger than the rest of the parents there that day. So foster parents really gain a lot and are really fortunate to have the opportunity. So I've been a big supporter, and I wanted to share that with you. Thank you.
Thank you. Thank you for sharing that, Supervisor Bjork, and thank you for being a foster parent. Any other comments? If not, without